Check, check. Hey, hello, we're live, we're here. Welcome back to the supply side stage. Coming down to the wire on day 2 of Supply Side West. We have a few show announcements and then we'll launch into our program today. Again, you've probably downloaded the mobile app. If you haven't done that by now, well, then you're probably not that inclined to use it, but I do find it quite helpful myself. There is even a map of the show floor and you can navigate your way to specific booths and locations like this. The Wi-Fi is sponsored by Cactus Botanicals. So come visit them at 4237. You can see the network settings right there up on the screen over here. Make sure your devices aren't on a ring mode. I think you figured that out by now too. And the exhibit hall closes today at 5 p.m. So I hope you enjoy this bit of sit-down time, and I hope you find the information that we're about to present intriguing. So let's get on with our session today. Our session today is brought to you by the Inside the Bottle program, which is a co-branded, supported program that publishes content and broadcasts content via Natural Products Insider as well as newhope.com. And what we serve to do and strive to do in the Inside the Bottle program is provide an accurate and positive and affirming narrative for the dietary supplement industry, partly as a counterpoint to some of the misinformation and misguided information we hear in the mass market, and partly to be able to educate the industry itself, because there's so much complexity and there's so many opportunities for not always getting it right, but hopefully striving for the best. One of the things that we decided to do in our programming for this year for Inside the Bottle was to dive deeper, more deeply and specifically with custom research into understanding some of the motivations and the gaps in information for dietary supplement consumers. We do know that there's some confusion about what a dietary supplement is, but you'll hear more about that in just a couple of minutes. I do want to just mention, as I said before, it's a co-branded and sponsored program, so you can see our sponsors, not this slide, but on the next slide for Inside the Bottle. And we invite you to visit those companies that are suppliers that are here as well, including Radical Science, specializing in very specific clinical research. So with that, I'm going to move along into our program. We have 2 presenters today, and then we'll launch into a discussion, and I will open this up for audience questions as well. So in the Inside the Bottle program, as I mentioned today, we did custom research this particular year in 2023, really looking at where the underserved consumer may be, not just making presumptions and assumptions about all consumers taking supplements, but understanding those that don't and where that opportunity is. So let me introduce our 2 speakers today, because we also will have another research, we'll also have other research that Pauline will talk about that's outside of what we did in Inside the Bottle, but part of and in part and parcel 2. So we have Amanda Hart, and Amanda Hart has worked for years with the natural products industry at New Hope Network, and Amanda is a data analyst, and she specializes in looking at consumer insight. So she'll be presenting on our custom insights and custom work that we did this year with Inside the Bottle. And Pauline Thorogood is the CEO and chairwoman, or co-CEO and chairwoman of Radical Science, specializing very specifically in clinical research for the dietary supplement industry and really understanding how consumers can trust what they're getting in the bottle is providing the benefits that they're expecting. So with that, I'm going to hand this lovely device to Amanda, and we'll get started.
Okay. Hi. Thanks for having me, Fran. Yep. And can you hear me okay? Oh, you need it to be louder? Is it my voice or is it the microphone?
If it's the microphone, I'll give her the handheld and you can turn that off.
Okay. Is this better? Okay, better, yeah. I can hear it. All right, so as Fran mentioned, why are we here today? What do we want to talk about? Inside the Bottle gets together every year to figure out what new questions they want to answer through research. And this year we decided to really focus on who isn't engaged in the supplement industry, who is the supplement industry not reaching. So we really wanted to elevate the industry's understanding of these consumers that are not regular users of supplements and identify reasons why, what are the barriers, what's preventing them from engaging in supplements, and then identify those topics for further analysis, discussion, identify opportunities, which we will unpack at the end of Pauline's, and look at those white spaces and think innovatively or critically about how to address these barriers. And so how we went about this was we did a consumer survey, and we did click balance them into the survey to qualify for what defines a non-regular supplement user. So we looked across a nationally representative population, and then we wanted them to be 18 years or older, a U.S. resident, the primary or shared grocery shopper, and then a non-regular user, meaning they take supplements no more than 1 to 2 times per week, or have never really engaged in supplements at all, to define our non-regular user. So we collected 1,500 surveys from this non-regular user sample back in the spring of this year, and the results of that survey is what we'll be uncovering today. So just a little bit of a demographic breakdown. The insights today will focus less on demographics, and we're going to focus more on what are the attitudes and perceptions that are barriers to these consumers engaging in supplements. But and we're going to pull out these occasional users, which will surface as kind of the low-hanging fruit and opportunity. Because demographic-wise, they do skew a little bit more like a regular supplement user. They tend to be younger, more millennial and Gen Z, higher household income, tend to reside in suburban areas, and skew natural channel shopper for these occasional users. So our non-regular supplement users are 27% of the population, and we'll unpack them a little bit more. So again, 15% of that non-regular users are occasional users, taking no more than 1 to 2 times per week. And then 4% have stopped taking them altogether, and 8% have really never engaged in that supplement industry when looking at total consumers. And so these adults lack an understanding of how what we see is that these adults really lack an understanding of how supplements can help. That's a common thread that we're seeing through this research. They really don't understand how they're regulated, how they benefit them, what categories actually includes a supplement, and we'll show that later on. And so this lack of familiarity is really feeding into other barriers and concerns, because what they don't really understand, they don't trust, they don't really engage in. So this is a great opportunity for industry participants and innovators to really think of how we can better reach and engage these consumers that are unfamiliar, that lack the education to feel confident that they know what supplements can actually do for them. And how can we grow their understanding of the value, the benefits, the safety of regular use? Good doses, not overdosing, helping them understand what is a good behavior to really receive those benefits. And so unpacking more about who these supplement users are, it's kind of just more of a pie chart distribution. So you can see that 3/4 of U.S. consumers are in fact regular users of supplements, taking them at least every other day, more than a few times a week. And then almost 1 in 5 are considered those non-regular users. So occasional users, again, as I mentioned, offer that strongest opportunity. Looking specifically within that 27%, occasional users represent 55% of the non-regular users, if those that want to do math. So in general, the non-regular users are somewhat or pretty satisfied about their health, as we see in this top row with the check marks being positive and the dashes kind of being a lukewarm response to how they feel about their health. And what we see about occasional users is that they are satisfied about their health, but they're also indicating to us that they're more motivated than the lapsed users or the non-users to actually keep that satisfaction up, engage, learn a little bit more about their health. They feel comfortable in the natural channel, but there's still a little lukewarm in their confidence of really knowing what is a supplement and how can it supplement or complement my health and life. So looking at how they behave in their shopping patterns, we see that this occasional group, so I'll be kind of going back and forth between the non-users in general and then focusing on that occasional subgroup. So this one is specific to those occasional users. And we see that they shop primarily, or where they get their supplements is primarily where they shop, which is mass market, where they get their groceries, right? Mass market and conventional grocery stores, as well as online, 29%. Drugstore or pharmacy is online 29%, drugstore or pharmacy is down at 24%. So they're not making necessarily an extra trip to go and get their supplements. They're really buying it where they get their groceries, meaning that there's an opportunity to really help clarify and define what categories are supplements that they could be paying attention to while they're grocery shopping, whether it's prebiotics, probiotics, omega-3s. So an opportunity to educate at retail. So digging more at what are some of the major barriers and unpacking that, we continue to see that lack of knowledge is a key challenge. And this is among all of the non-regular users looking at this data. 66%, when asked how confident they are about their level of knowledge, responded, not at all, not very, or have neutral confidence. That's 2/3 of the non-regular users just don't feel like they know what to even think about supplements. And a smaller portion of 22%, they demonstrate a lack of, they indicate that they have a lack of trust in the industry. They don't believe that health claims on supplement packaging is trustworthy, and they believe that supplement companies are somewhat dishonest. And then 15% have efficacy concerns. They decrease supplement usage because they couldn't tell if they were helpful or didn't feel they were helpful, and don't believe that dietary supplements are effective for general health or acute specific conditions. So the biggest low-hanging fruit opportunity is to educate on the value, the uses, what is a supplement, how can it benefit their lives. And then the other opportunities, not as much of a barrier, but still an opportunity, is to demonstrate that products are safe, reliable, regulated, and prove that through your research, through your verification. And 15%. And then the opportunity for concerns is, again, do studies, help demonstrate that. Build trust with consumers that these are efficacious. But you can't get to these other two until you arm them with the knowledge they need to feel like they can have agency and make informed decisions. Another primary barrier is that some feel disconnected or doubt the value of supplements. 39% feel that they don't have access. They can't easily access supplements in the stores that they shop, or natural health food stores aren't accessible. 28% have concerns about value. They don't believe that dietary supplements are affordable or worth the money. And they decrease supplement usage due to rising costs or needing to save money. And 20% don't feel welcome in the natural channel. They don't believe that natural or health food products are made with them in mind. So there's an opportunity to look and identify what would feel them welcome, how could we formulate for these non-regular users, Another opportunity is focus really on the value. If you're spending this money, what is the return that you're going to get from investing in supplements to complement your lifestyle and your healthy habits? And there's an opportunity look for ways to be proactive in your distribution, to find new areas to make them feel like they have access and opportunities to supplements. So we also wanted to look at these barriers and kind of see how they intersected with each other and what happens when they overlap. And lack of knowledge feeds into every other concern that non-regular users have. It's kind of that ground zero. Those that have a strong sense of lacking confidence in their knowledge then also experience strong concerns about efficacy, or score high that they feel uncomfortable in the natural channel, have concerns about value, they lack access to supplements. And then concerns about value also, when you have concerns about value, you have a high mistrust and you have concerns about efficacy. So the highlighted portions really show where there's an overlap in the barriers. And when we also surveyed consumers, we wanted to understand what were the reasons that they stopped using supplements. 53% of the occasional users said, I wanted to reduce my expenses or save money. 39% of occasional users said that supplements were getting too expensive. And then you look at that from the lapsed users, it's 37%, 29%. Another major reason that they stopped taking supplements is just habit. They can't remember to take it. They can't remember to be compliant. And so it's a struggle. It's easy to give up. Well, I've forgotten to take it. Now it's not going to be efficacious. I give up. The other thing that's notable here when we look at price and value, 45% of occasional or sporadic users say that they are neutral, that the supplements, that they're getting value in supplements for their money. So that neutral space, I always kind of like to think of them as undecided. There's a little bit of wiggle room there to kind of tease that out and help guide them towards a decision. We want to get them towards a 23% agree or 9% completely agree. So this is an opportunity to educate them, help them see the value, and value would then hopefully bring down these numbers, and I need to save money to reduce expenses, but I'm going to buy my supplements because I see the value in them now. And this interesting chart here takes information sources that non-regular supplement users look to for information about health and supplements, and mostly supplements, and then how much they trust that source. So we see the internet, 53% say I rely on the internet, 28% trust it. Doctors and physicians are still ranked pretty high at 43%, and it's a source that they strongly trust and rely on. So there's a bit of an observation that they're still seeing supplements as a kind of similar to where you go for pharmaceutical information, which is doctors, nutritionists, and physicians. So there's an opportunity here to find other channels to really communicate how consumers can get information about supplements and feel educated and feel like they have the knowledge they need to make decisions. And what this last slide is interesting because we asked consumers, we didn't define supplements for them. We wanted them to use these buckets of how NBJ, Nutrition Business Journal, market sizes the supplements industry, and these are the primary categories. And so we asked the non-regular users as well as the regular users to indicate which categories they consider a supplement. And we see that the non-regular users are significantly lower on all of these categories. Only 42% see omega-3s as a supplement. And that gets lower at prebiotics and sports nutrition and herbs and botanicals, 41%. So there's just an opportunity for them to see which categories can really offer various supplemental benefits for a variety of health needs. And so I'm excited to get into the debate and the conversation after this to unpack opportunities. But before I do that, Pauline from Radical Science is going to talk about her research results.
So before I get go, you can hear me, right? So we're good? Oh. Can we turn me off and I'll use the handheld? Is this any better? Okay, great. Well, first of all, thank you, Fran, for having us, and thank you, Amanda, for that incredible presentation. I couldn't agree more that consumer education is key to the growth in the supplement industry. It's by improving consumer literacy on the value of supplements, a use case of supplements, how to read labels, and how to assess the veracity of those labels, that we can actually increase trust and, build additional customers, reduce churn, and overall build the industry. So that's basically what I'm going to be talking about. And I'm going to be talking about not what we do at my company, which I'll briefly mention as well, but really about consumer research, consumer psychology research we did in collaboration with UC San Diego on the factors driving supplement purchases. So before I go into that, though, I thought it might be fun to do a bit of a year in review, since we've had quite the interesting year, especially as the ripple effects from last December's FTC update to their health compliance guidelines, and quite a few things happened since then. We've obviously had FTC's investigation into social media channels for allowing paid advertisement of products with inappropriate health claims. And those channels are everything we use, from Meta to Twitter to TikTok, etc. Next up were the nearly 700 warning letters to brands for basically asking for them to provide backup for the claims that they're actually using. Next was clarification to celebrity endorsers, influencers, on how they can also be liable for things they say about the products that they're endorsing. So a lot of regulatory stringence. In the backdrop, there's a ton of articles on mass media written about, false or inaccurate claims about health and wellness products in general, how there are a lot of dubious words that are being used. There's a lot of science washing that's actually happening out there. And then there was news, Washington Post reported it, on how influencers, including dietitians, are actually out there promoting products, leveraging their platforms, but they're actually using inaccurate information. So unfortunately, there's a lot of misinformation out there. There's also some good, interesting stuff happening from a vigilance perspective. So some of the biggest talent agencies are actually now asking for substantiation on the products that their clients are going to be endorsing. That's a good thing. That actually brings up the standards. Another thing that's actually happening is that retailers are asking brands for substantiation on the products that they're going to be carrying on the brick and mortar stores and even on online stores. That's again a good thing, because at the end of the day, that's going to engender consumer trust. Actually, Gaia was on stage on Tuesday during one of the education sessions, and it was really cool because they're a very conservative company. They don't make crazy claims at all, and they indicated their substantiation requirements had increased, including on product names, not even on claims. A product name, Stress, had to make sure that they actually had the substantiation to show that they were doing something for stress. So retailers are actually upping the game. So that's where we are. There's also, of course, all the Amazon counterfeit issues that we're not going to go into, since we're dealing with them together. What's really interesting is I read about this as I was preparing for this presentation, is there's some really interesting social psychology research out there, a peer-reviewed journal on several thousand people, that is actually showing consumer buying behaviors are now much more interested in science and science information. What's equally interesting is that it's very hard for them to differentiate between fact and fiction. And what's more, consumers who trust science are actually more likely to spread misinformation and share fake claims because they actually trust science. And during the study, several thousand people, when they were reminded to, the value of science, their behavior didn't change. But when they were reminded to actually do critical evaluation, do critical thinking, which is really the core of science, their behavior did change. So the bottom line is, blind faith in science without digging deep doesn't take us anywhere. It actually leads to pseudoscience. So we really need to ask the questions when we see science-backed, etc. How was that science conducted? How rigorous was it? Who are the people who conducted it? Are they legitimate? So we need to ask the right questions. That's when we actually get to the bottom line. Oh, sorry, that's, are we there? Yeah, we are. So how do we solve this problem? It's really through clinical research. It's by actually seeing if these products are clinically validated. That is really the ultimate source of showing a product is actually effective beyond placebo based on the results of a rigorous clinical trial. That was the topic of much discussion on Tuesday during one of the education sessions, where we discussed what are the best strategies for both brands and ingredient suppliers to actually get there, to be able to actually show that clinical proof of effectiveness. We need the double-blind, placebo-controlled trials. We need statistical significance to show that, your product is beating placebo with statistical significance, and it's not just, it looked pretty good, but we don't have enough data, which means larger populations. And they also, of course, have to be done appropriately with FDA, FTC standards. That, I think, will really help all of us deal with regulators better, and most importantly, ensure that we have consumer trust. So all of this led us to actually think about how can we really understand the psyche of today's consumer, given all that's happening in the marketplace. Let's understand what they think when they see the word clinically proven. Does it change their behavior? Does it actually make them want to have a different purchase intent, improving purchase intent? Does it change their likelihood of paying more? There is data out there that products that are certified organic, can attract more attention, as well as they can absolutely garner more better premiums as well. So that was our hypothesis, and we want to partner with an amazing university such as UC San Diego to actually do this consumer research to understand their psyche and understand really the factors that are driving their purchase decisions. So it was a pretty decent sized study, over 1,200 people. We had gender parity, equal number of men and women. And if you look at the demographics, it's actually a pretty educated population. So more than half had university education, including grad school. So you would expect these people to actually have a higher level of literacy. But overall, I think it's pretty reflective. One of the things that is a bit disappointing for me is the fact that it was 83%, 83% white. We do have other ethnicities included. Future research, which I'll talk about, is actually going to address that, because one of the things we did see was there were some differences between different ethnicities, but we didn't have statistical significance for me to be able to talk about it today. Again, goes back to the importance of having an appropriate population size. So, one of the first questions we asked was understanding how people reacted to the term clinically proven. And we basically asked, if you're stressed out, which of these products would you actually be selecting, and basically randomize the question. So the design of the study was, of course, appropriately done through the cognitive science department, etc. And people were randomized to one of these bottles. Everything looked identical except for the label. And based on these responses, we were trying to determine whether people were likely to purchase one or the other. And Basically, there was double the number of people, twice as many people actually indicated clinically proven is something they would absolutely prefer to purchase, far more likely to purchase. So part 1A of the hypothesis that clinically proven is a good term, check. What's perhaps more interesting is question number 2. So based on your desire to purchase, how much would you be willing to pay for it? So again, the participants, the 1,200 plus participants, were randomized to the product they've seen and asked to determine how much money they were willing to pay for this product, from $0 to $100, and using a sliding scale. And when we looked at the results, it's pretty impressive. There is a 20% more difference in willingness to pay. Very, very similar in some ways to, certified organic. People are willing to pay more for something they trust. And so this is basically equal to about $5 more for a product. So basically, you're able to actually have a significant premium on your product if you have clinical proof. Next up, which is probably one of my favorite parts of this study, is really having a better sense of understanding what are the areas that people consider when making purchasing decisions. These 7 factors were put up, and of course, they were in randomized order to ensure that there is no bias in terms of which one came first. And they looked at everything from purity, looking at whether contamination was a factor, to product taste and smell, whether the product is organic, about user reviews and how we react to user reviews, how we react if it's been recommended to us by someone we know. Of course, whether a product was actually proven effective in clinical trials, as well as whether it actually had ingredients we recognize, whether that familiarity had any impact on things. So, drum roll, please. And these results are pretty cool. So, I've heard this from actually other studies as well. Without question, the number one reason people actually look at when they're buying a product, and this is the primary purchase decision influencer, is if a product has been proven effective in clinical trials. And with number 2, not that surprisingly, is that it's clean. It has been tested for contaminants, heavy metals, microbial contamination, etc. So we know what we're putting in our body is actually indeed clean. What surprised me a bit was how important the user reviews were. Evidently, I think we're still believing them, even though some may be bot-based, but clearly we're believing in them. And again, surprising to me was the fact that it was organic was not that high. But again, these are the results from a very large-scale study of, I'd say, relatively educated people. I mentioned at the beginning that one of the things I lament is the fact that it was a primarily white study with over 80% white, because we had signal to see that different ethnicities actually looked at different things differently, and contamination and organic, etc., actually ranked differently based on the different ethnicities. So very much look forward to making sure that we have additional data to see how different education backgrounds as well as different ethnicities actually may be reacting to this. So the conclusion of this research, which is really the beginning of our next research, which I'll talk about, is that consumers are indeed more likely to buy and pay a decent amount more, 20% more, for products that are clinically proven. To our knowledge, this is really the first time such a large-scale study has been done, and understanding consumer psyche, consumer intent to purchase. So we're not done. We have so many more questions on what came out of the study we did with UC San Diego. We decided to spread the wealth, and so now we're going to work with UCLA on a next study. And with that study, and we're working with both their psychology department as well as with the Anderson School, their business school, on the marketing side of things, to really understand consumer perceptions on implicit claims. Implicit claims are things like science-backed formula, clinically proven ingredients, doctor formulated. If people actually believe, that means that product has been fully clinically proven, that would actually make an implicit claim. And according to the FTC, as little as 15% of people believing something based on what they read, even if that thing doesn't explicitly say that, it's actually still seen as not having sufficient truth in advertising. So this is really, really important. We are going to be looking at some of the most common language used on labels to understand consumer perceptions. We're also going to look at some of the design elements and labeling and naming of products, including doctors, MD, etc. Maybe designs that indicate something more medical on them to see how they perceive. Amanda talked about, even industry misperceptions regarding between pharma and nutraceuticals and people not fully understanding things. So we're really trying to understand what people think, what people see. Again, this will be a very large-scale study, and we'll make sure we also include sufficient ethnicities to really see what those variations on the theme are as well. So why are we here? We're here because clinical trials originally, which is really the highest form of validation, like I said, were designed for patentable pharmaceuticals. They're very expensive. They're pretty damn slow. I know that because I've been involved with them for several years. And that's great for pharma, which can afford the time and the dollars, but they have been out of reach for our industry until now, right? So the problem is, because of this, many of you at best can do clinically proven ingredients that you actually study your ingredients to do your best because it's too expensive to study the full formulation. Or you do substantiation dossiers, look at what's in literature, what's been done on other countries, what's been done on animals, really understand the dosages and how these different products work. Everybody is having the right intentions, but we do know ingredient synergies or antagonistic relations may actually result in different results, not to mention dosage obviously matters. So we're here because clinical trials have been out of reach. But what I want to say here is we have to shed old beliefs, and that's why I have the Adam Grant quote here, and realize that the reason they have been out of reach is because they were done in a different paradigm. We live in a totally different world where virtualization has brought down the barriers for geographic as well as socioeconomic participation in clinical trials. They also made them a whole lot cheaper. So now we can actually have much larger scale trials that actually address our entire nation. Getting that census parity with gender parity, including rural populations, including ethnicities. We also have incredible technology. We live in exponential time, guys, right? I mean, AI is changing everything. Tech has revolutionized the world over the last 20 years. Why are we still using old style stuff? So this is where new thinking can solve permanent problems that we've had with clinical trials, and that's actually what we do at Radical Science. What we've done is we're offering the first proof-as-a-service platform to enable supplements to have both easy and affordable access to rigorous clinical proof for the first time, so that you can actually have rigorous proof at unprecedented affordability, speed, and scale, leveraging an AI-enabled tech platform that uses virtualization, that uses automation, so that you can actually have a 500-person clinical trial for $90K and under 6 months. Something that is not just within reach, it's actually something you can do today. We are changing the paradigm so that this becomes the norm, so that we don't have to be questioned about, are our products clean, are our products working for our unique bodies? And because of the diversity of the trials, we're also able to understand the variations on the theme and how it works for different bodies, different lifestyles, and different life stages. So as in closing, and of course we're going to have a great discussion here, I'd like to welcome everyone afterwards to join our live clinical trial we're doing on Supply Side West Stage at our booth number 2665 on non-caffeine energy products, so you can actually experience how it actually feels to be part of one of our trials. Thanks so much. Look forward to the conversation.
Thank you, Pauline, and thank you, Amanda. I'll take that control, actually. So we're not done yet. We're going to have a discussion. And, when I listened to the data points, and I was part and parcel to asking the questions that modeled the custom research that we did, the answers also raise more questions, and they probably have for you too. And we're going to examine some of those and look at some of those from an opportunistic point of view too. And I don't mean that to be trite. I mean that to be real opportunity for supporting consumer health and for upping our quality in what we do. I would just like to note with the custom research that we conducted, one of the intriguing findings that Amanda touched upon, we didn't dig into too deeply here, was how confused those consumers that don't really use supplements are about what a supplement is. I think here we are in the midst of supply side. This is what we do. This is what our business is. This is what our values are. And I think we miss the forest through the trees sometimes. I think we don't realize that people have no idea what it is we're actually providing to them. And it's very, very confusing for many consumers. So they shy away not only because they don't trust what the product is, perhaps, but they don't really even know how to model that in terms of their habits. So that, again, is a problem, but it also presents opportunity and the potential for solutions in the way that we view what we do and how we communicate. I also find it quite intriguing continuously that probably the most trusted place for information that people go to, especially those that really don't understand dietary supplements well, are their physicians. And I'm not going to bash physicians by any stretch of the imagination. It's a very important part of our health care. However, they are not trained and they don't have the curriculum built into what they do to understand physiology in this way and the role that dietary supplements can play. There are a few that do, that take that upon themselves. And then, of course, there are naturopaths that really lean into that more. But many consumers think that they should be going to their trusted advisor, their healthcare professional, but their healthcare professional is limited in the information that they understand or that they expose themselves to. So we're going to look at how we might reevaluate some of the findings that we talked about today and maybe recontextualize it. So we'll have a little discussion here, but I will open it up also to questions. And I don't have another mic handy, so if questions come up in the midst, I will jump so we can hear you. Oh, we do have another mic, so it's there. And I also just want to ask our AV folks if you can test our speakers' labs again, just to make sure that they can be heard.
Check.
Can you hear me? Okay.
Was it okay as well? Okay.
So that way we won't be jumping around with this.
Fran, can you hear me?
We can.
Okay. I wanted to, going back to that slide that I have, which says physicians are a trusted source, which you were just talking about. I think also just continues to drive home that they're going to a reliable scientific advisor. And that continues to underpin this clinical proof that your products can actually meet the need that it is that it is offering.
Desperate time.
Desperate measures. That's right.
And I hadn't thought. And so one way I think about that is we need to ramp up channels and how you meet these non-regular users for communicating and educating with them. But you double that up with that clinical research because that's to me indicative that they're trusted because they're science-backed. They've been through years of school and education and knowledge to be trusted, and so that's where that clinical research comes in and can be used in other channels.
And just to completely echo what Amanda's saying, doctors recommend pharma not just because there's a bunch of reps go sell them stuff, which is probably part of the reason, but really because there is data that is showing effectiveness beyond placebo. If there is evidence showing certain products are actually beating placebo and they're a whole lot cheaper and you don't have to deal with these massive prices of pharma and you don't have to go through insurance and you can actually go buy it, doctors will be looking at this as an alternative with possibly lower side effects as well. So I think the more data we have, we don't just increase consumer trust, we increase consumer trust also via their trusted advisors of doctors, like you said.
Mm-hmm.
I do think that there is a different paradigm that is difficult for consumers to grasp. I think the pharma paradigm is it is a treatment paradigm. It's not just what I think, that's what it is. And the dietary supplement paradigm is not that. It's not a treatment paradigm. It's a movement to health. And I think that that's challenging for consumers to wrap their minds around. And I think, as most people in this room do know, or probably should know if they don't, prevention claims are not allowable on dietary supplement labels in accordance with DSHEA. But indeed, the purpose that many people look to supplements for is to prevent degeneration, to prevent challenges in the future. So we can't make those claims specifically in that way on a label. So meeting consumers where they are, it seems quite clear, the evidence is quite clear, that giving people some intelligence about clinically supported and clinically verified can make the difference. That said, they don't necessarily understand what's behind that. So again, I see that as an opportunity, an educational opportunity to further that knowledge. And well, what does that mean, right? So more about how we meet them where they are.
So I'm sure you have a lot to say there, but so Radical Science is a B Corp. We're a public benefit corporation, and we are truly on a mission, a movement to increase consumer literacy, to actually have proven access to proven democratized products. So how do we do that? A, by doing the clinical trials that we do at these much lower prices, much faster. But we also, at the end of each of our clinical trials, we unblind every single participant. We give them their data back in a very intelligible format, something they can read themselves, understand how this product helped them, how they got their sleep better, fell asleep faster, didn't wake up as much, whatever it is that we were studying with them, in a format they can take to their doctors. So we are trying to change consumer literacy one consumer at a time. In the last 2 years, we've studied over 40,000 people. So we believe that's going to actually make a difference, because people, once they understand their own data, they're going to make much better, more informed decisions.
Well, and I do think sometimes we don't see the forest through the trees. Also, industrially, the obvious thing may be sitting right in front of our faces, and we just don't see it because we've been looking at it for too long, right? You ever look at one of those images that have sort of hidden pictures in there, and you just keep staring and staring and you can't see it, and then all of a sudden it appears if you recontextualize your point of view or the lighting. So I just want to address this last point on this slide here too about supplements, and is supplement even the right word? I mean, it seems like a crazy question to even ask. That's what we do, we supplement the diet. But I think that when you look at that forest through the tree concept, what about explaining that more, explaining what we think is the obvious more obviously, that we are supplementing the diet, right? So help people understand help them have realistic expectations about their dietary supplements. Any thoughts on that?
Yes, I think that you're right. I mean, let me back up a minute. First of all, Pauline, I love this almost bottoms-up consumer engagement approach that you're taking. It's a very active role that they can play, and is an amazing touch point for them to feel like they're participating, and it passes on knowledge, it passes on perspective, and so that is such a fascinating undercurrent and ground level channel to explore. I love that. The messaging, I think that maybe consumers are like, well, now I'll be a superhero. I'm going to take this and I'll be invincible. Or it doesn't. Pharmaceuticals actually have many pharmaceuticals work to make a notable change, so you don't feel the pain. You're really preventing a disease state, and supplements aren't meant to do that. And so we really need to work on that messaging of how to hang in there and see the dividends further out than just tomorrow.
Without side effects.
Yeah.
Or with minimal side effects, right? So we always need to do side effect monitoring. But thank you for that, Amanda. One of the areas also is, we live in times where everything is super targeted. I mean, we all get targeted advertising as to when to get a product, when to feed our pets, when to go to the coffee, anything, right? Except when it comes to medicine. We're talking about precision medicine, we're still not getting close. We will only get to precision medicine if we actually study enough of us to understand the variations on the theme, and not just on genetics. We talk about genetics a lot, and it's so important. But do you realize that of less than 5% of what happens to our body is based on our genetics? It's really epigenetics. How we live, where we live, what we eat, the stress, and all these things actually affect how we perform. That's real. That's actually what the medical world says. So because of that, we need to actually understand when we do clinical trials, where we live, how we live, work habits, coffee drinking habits, alcohol, exercise, all of that, lifestyle changes, as well as life stage differences. And as we get more data and more data on a larger population, we can actually leverage, and don't kill me for using the big word, but using AI to actually leverage this big data to understand the clusters, the segments of people are actually responding differently to different products, to different dosages. And that, I think, is going to get us to much closer to precision medicine. And that precision medicine could be in the form of your supplements. It's not even what you take, it's the dosages and the variations on the theme of what you take. I go to my functional MD, I take a lot of supplements, and my dosages are for my body and for where I am in life. And I think that's what if we all do that, we can be in such a better place.
Couldn't say that better. Before I move on to the next slide, I just want to acknowledge the importance of being on the cutting edge. And okay.
We can be very loud.
Oh, that's better.
Yeah.
So the importance of being on the cutting edge and thinking differently. And I want to just ask a question before I move to the next slide, just related to what you see and the questions on this slide and what we're discussing here. And no pressure here, you don't have to chime in, but I do just want to open up the question to the audience just to see if there's anyone that has any thought about whether you think we should be addressing the way that we define supplements. I'm not saying that that's a full industrial initiative that could or should happen. I just want to hear if there are thoughts on this, when we're understanding that supplement as a word and as an idea and as a practice in your habits is completely misunderstood by a segment of the population. Are there any thoughts here about whether that should be addressed or thoughts about how that could be addressed? Just love to hear from other people. And again,
Join us.
no pressure. Well, think about that, because we'll come back and you can have another opportunity. I know that I'm thinking about that, and we talk about that quite a bit in the work that we do together and the content that we produce for the industry, and that we do try to make others outside of our echo chamber aware of. So let's talk about reframing the conversation then, leaning into that. So do we need to think beyond problem solving? Non-regular users, again, they might be researching supplements if they knew they were medicine or not medicine, comparing them against pharmaceutical solutions. Again, not really understanding a differentiation between pharmaceuticals and prescription medications. We're not even talking about just OTC and dietary supplements. So how do we think differently about problem solving? Let's just talk about that first. Are you meditating?
Thinking. I don't know. Let me think on that.
I think, that's why that's exactly why I put the Adam Grant quote up there. We do need to think differently about current problems. What we have done with Radical, with our proof as a service, is we have created a new category. It wasn't like we have great carriages, let's add more horses to make it faster. We're like, no, that's just not fast enough, and it's never going to go fast enough. Let's invent something new. So I think that's the opportunity. We have to actually look at what's possible, what's available today. That's why I keep if you haven't figured it out, I'm a tech girl, so I do believe technology has the opportunity to at least solve some of our problems. But that's where I lean into technology is let's look at ways where we can actually lower barriers to entry. I think a lot of the problems we have today are because things are too expensive or too hard to access or take too long, so it's not worth it. How do we leverage technology to solve those problems so that we don't just assume they're not doable because it wasn't doable before? And I do think that is actually reframing the conversation, and I do believe by making clinical trials available and possible from every CVS and Rite Aid and Walgreens, why not? Why don't we just make it easy when people are actually buying? It's going to make life better for them. They're going to have more foot traffic, and we're going to have a higher percentage of the population going to clinical trials. And they'll also understand the difference between, Tylenol, that's an OTC, even though it's right next to oxacillin, which is not. So the point is, consumer literacy will only happen if we have a conversation. They're not just going to divine it from out there. So we need to actually help educate them. And I think we have the opportunity to do it through many areas, through many interactions, as well as leveraging technology to lower barriers to access.
Yeah, and I think that for, I guess I'm hearing two things, Fran, going back to your question of how do we think about supplements and framing what supplements are. So it's like engaging consumers in general on the role of supplements. And I see that as where brands have an opportunity to be more proactive through social media, through short stories, to really communicate how to think about supplements compared to food, compared to pharmaceuticals, and really giving them a role, a function that they play. And then to Pauline's point, and a big part of what we're talking about today, the other part of the conversation, then what are the best practices in good, effective, quality supplements in the marketplace? And then that goes into investing and looking at clinical trials. And I guess my answer is more of a question, Pauline and Fran. I'd be curious to know, and tell me if I'm completely off the wall, because we were just talking about this earlier, but with companies that are just struggling to make ends meet and to democratize research, can they pull funds together? Like if I'm a turmeric brand, I want to use turmeric in my formulation. I want to use ashwagandha. I want to use this. Can we, as 10 brands that are going to be sourcing from a variety of ingredient suppliers, standardize that somehow and come together and fund these studies as a cohort?
That's an interesting idea, but before we even get to that, which I do love that idea about actually working together, and collaboration is always a great way to do it. It's a way to do it. It's not the only way. It's we spend a lot of money on marketing. We are at a trade show. We spend a lot of money on marketing, right? But we just seen that clinical proof doubles the number of people who are willing to buy a product, and they're willing to pay 20% more. So investing in science that is actually rigorous science that's going to convince the customers that this is stuff that's going to work. And then, oh my God, it actually does work. So they're willing to buy more, as in it reduces your churn. I would think your investment is going to pay back in multiples because you have a product that works, which means adherence and churn are two huge problems. You're going to have a product that you're taking because it's helping, and then you're going to go buy another bottle, and you're going to buy it sooner because you're taking it more quickly. So to me, yes, we just need to show that it works. And going back to personalization, that's why I believe that's really important, because even in a clinical trial, if you just did it, we don't do this, but if you just did a great clinical trial on men only and it worked, that's fantastic for the men, doesn't prove it's going to work for women. And so when the women take it, it doesn't work for them, they're going to oh, well, maybe I won't take it. So that's why the diversity is so important. We want to make sure that data is generalizable to the population so that that data is meaningful to each of us. So the more diversity we have, the more relevance of the data we'll have, which means, again, less churn, more adherence, and clinical proof. Actually, you're able to charge more and you're not paying insurance, you're not dealing with pharmaceutical prices or side effects. Again, it's not an or, it's not one or the other, it's an and, where we actually have an equal playing field with proof on either side, understanding what works for whom and what are the side effects for all these products, so we make better decisions.
Wow. So
Not passionate.
no, passion is key. Just two comments on things I'm hearing from both of you. One related to cost and value. I think that the dietary supplement industry has repressed its costs. They actually haven't actualized those costs through the vertical to the consumer, where quality is concerned, and what's required behind the scenes to be able to validate that quality and to validate through clinical evidences. And we have a challenge there as an industry, because we've conditioned the consumer population to expect inexpensive products. Because even an expensive dietary supplement is still a pretty inexpensive product. So I think that there's again communication about what's actually happening behind the scenes to change the value conversation and to change the proposition. My other comment is related, sort of more forward-looking and positive in terms of opportunity, and that's consumer empowerment. So if the dietary supplement can reposition the way that it itself talks to the consumer in marketing about what's possible. It's not, again, a pharma conversation about we're going to fix what's wrong with you, but more about taking control of your health and a personal empowerment message. I think that that's a very, very powerful direction. And it seems like a little tweak, but it's a big deal, because it's not the perspective that the industry has taken in its marketing to consumers. And I think it's a very important underpinning of what is in actuality represented in the dietary supplement space. So before I move on again, I just want to open this up just to see if there's any other thoughts or comments here just about cost versus value, or just how we're positioning ourselves again in the market. Again, no pressure. I just like to open it up and provide that opportunity if there's any thoughts. Because I know we're saying a lot of things here, and sometimes you get an idea and then it goes in and out. All right. So I also just want to say, too, that if you're interested in digging a little bit more into the information that we've presented and that we're talking about, too, obviously you can talk to Amanda, you can talk to Pauline, you can talk to me, and I'll have my contact up later. But we have dug in more deeply into the consumer research and a report and reporting that we've done. So you can find that on Natural Products Insider and newhope.com as well. So we have a few more questions. Oh, no, I didn't want to go there. Yes, here we go. Sorry about that. So opportunities. Let's just talk about this again opportunistically. Clinical research and science-backed formulations is a primary driver. We've been talking about that, but let's just really zoom in a little bit more before we close today. So closing that knowledge gap, making this an industry priority. I mean that. This is where I'm personally passionate. I've been in the dietary supplement industry for 40 years. I was a retailer, I was a wholesaler, I was a brand director, and now I'm a content director. I'm an educator. I want to change the way people think about personal health, personal responsibility. How the industry needs to make this a priority, needs to close that knowledge gap. What we're hearing is a big fat knowledge gap. The industry continues decade over decade to do what it does I believe, inside a bubble, honestly. And that said, the data indicates that we don't see a slacking off in dietary supplement sales. NBJ is a part of our business, and we're tracking this all the time. And we do see adoption. We do see people looking for different solutions. But we also see this incredible gap. And it's not just about the industry itself. It's about public health. Public health. How can we create a healthier society? How can we reduce these residual costs to society? This is really what our industry is about. Now I'm pontificating, but I really do feel very, very strongly about that. So closing the knowledge gap can make a huge difference in public health and the costs to public health. So I just also want to hear what your comments are. Pauline, Amanda, if you have any thoughts on that matter.
I would love to comment on that. And thank you so much for that pontification. Agree with every point you made. Thank you for that. And about public health, how can we actually say we have public health when less than 5% of the US population has been through a clinical trial, and that number is far less for women and way, way less for minorities and rural populations? How can that data be representative of our population when we're actually not studying our population? So to me, there's a huge issue there. So that's just morally wrong. But back to everybody's in it to make money, which I absolutely am good with. I just believe it's an and there. You can be good and make money, and this is what I'm going to suggest. The data shows, and this was a report that was given to U.S. Congress by NASEM, which is the National Academies of Science, Engineering, and Medicine, last year, so very recent data, that the economic cost of us not studying our population and not actually addressing women, minorities, and rural populations, literally what I just mentioned, is hundreds of billions of dollars in lost income because people don't go to work, because people actually get disabled, because people die, and all kinds of other healthcare issues, right? This is actual massive cost, and just a 1% improvement in that discrepancy would actually provide, they said, this is the NASEM report, $100 billion improvement. So let's follow the money and do the right thing. We can do this.
She's very inspiring. I love it. I am going to go to the booth and become a...
Please, all of you come. Join making history together, guys. I mean, we can do this, and it's possible today. It wasn't possible 5 years ago, so it's up to all of us.
And what I love about what Radical Science is doing is, like, you talk to so many experts, and probiotics they're still very broad for the broad consumer population, and they're not targeted yet. And when they're not targeted, there's going to be some reactions among consumers, and they're going to have a bad experience, and they're not going to come back to probiotics. So I love what you're unpacking here about the evolution in AI and really engaging consumers and disseminating, so more about how discrete subgroups and segments are responding, and it's becoming more, what was another word you used besides personalized? Precision medicine or personalized
They're not the
nutrition.
same. They're very related, but they're not the same.
Okay. And that is important because consumers could have a bad, the skeleton is in the closet is that certain reactions could, prevent consumers from coming back. And so that research can help personalize and make sure they're having targeted experience based on their unique constitution and their biology. So, let's check back in 10 years and see how we're doing.
Hopefully we can get back in way sooner.
Yes.
I mean, in the last 2 years, we studied over 40,000 people.
Yeah.
We expect to have studied well over 100,000 by end of next year.
Yeah.
That gives us getting closer so we understand what's similar. In our clinical trials, even when things beat placebo, which, they often do, doesn't mean it worked for everyone. It's not like 100% of people get benefit. We're able to do, again, machine learning to understand which clusters of people it was even more effective for and which clusters it wasn't. And we give that data back to the brands so they can do more targeted marketing and actually, distribution so that they know which groups their products will be more effective for. So your point is exactly right, but we have the possibility to get that data.
And then the other thing that's awesome. And then the other thing I wanted to say about closing the knowledge gap, make this an industry opportunity. Just going back to, I realize you guys didn't get my social media data, that was from another presentation, but like engaging your audiences through social media, we're seeing more and more consumers, as younger generations, Millennial and Gen Z, are spending more time for product discovery as well as a resource of information before they make that decision. So social media is playing a dynamic role in really engaging consumers. And then one other plug here is the trend research that we do is foundational wellness, such as brain health, good cognitive function, stress, immunity, and digestive health remain most top of mind with consumers. And I think of those as acute conditions that they're looking for support, but I realize this is how to help the underserved consumer, but going off on a little bit of a tangent, all consumers are saying, yes, I need help with good cognitive function, memory, focus, clarity. I want good digestive health, and I want immunity. And so those are kind of key opportunities for functional food and beverage, for supplements to remember as you think about engaging, meeting consumers where they are.
Yeah, so I want to be mindful of time and mindful of everyone's time here. And so I'm going to just tap on a couple of other points here. But I do want to mention something about touching people where they are through social media, through the vehicles and the channels that they are regularly connecting with. And I just want to suggest also industrially that we start thinking about education, actually where education is happening or where there are challenges with education, but in the public school system, and brands and companies actually thinking about partnerships out in educational environments. Something that we did at Expo East this year, the finale of Expo East, but we brought in kids from inner city school system in Philadelphia and brought them on tours through the natural products environment to just raise awareness about thinking about better quality consumer options and opportunities that way. So I think that there are some other kinds of grassroots opportunities that exist that we're not thinking about either, and that has to be happening on a company by company, but maybe even within the associations. Again, I'm mindful of the time. And key opportunity number 3, talking about demonstrating value. I think we talked about that quite a bit already today, and really talking about a communication strategy that can make sense. So it's not only the where you're meeting people, but what is it you have to say, and how are you saying it in ways that are meaningful for people. And of course, focusing on efficacy and safety is always, always, always a top priority. People need to understand that that is the top priority for the dietary supplement industry, first and foremost. So before we just wrap this up, again, I'll just see if the two of you have any other last comments, ask if anybody has a question at all, and we'll wrap for today, but we're really happy to be a resource for you at any time.
I wanted to actually comment on what Amanda was saying, because she's so correct about, the focus on, gut health, immunity, the brain gut connection, etc. Our body is shockingly connected. So, looking at different parts of our body as if they're separate is probably not best practice. We all know this. So I'm, being somewhat cheeky here, but purposefully. So because we do very large scale studies, we also power our studies not just for the primary condition, such as gut health. We're also able to look at secondary conditions and even exploratory conditions to understand what might actually happen. Some of our studies, companies beat placebo across primary and secondaries. A recent study, actually, the company came to us for a specific condition, and they were very thankful we had the power, because they actually didn't beat it for the primary condition. They beat it for the secondary condition, because at the end of the day, what came first, the horse or the cart? In this case, the secondary condition was what they were really improving, and there was effect on the primary, but they didn't know that until the clinical trial actually showed that. So we got to look at the holistic picture. You only can do that with these larger scale populations, that studies that get you both the personalized data, but also understanding the connectivity between these different conditions.
Thank you for that. So I'll leave us with just a final thought about a systems approach as an industry to really thinking about meeting consumers where they are, changing up the formula, so to speak, and really leaning into the science, because that does speak to trust for the consumer, and we just need to educate the consumer, and we need to educate the industry itself on what clinical science done well really is about. So with that, I'm going to thank everybody for joining us today for our session all about the underserved consumer. And indeed, Everyone in some way is an underserved consumer. So we're very happy that you were here today. Thank you, Amanda. Thank you, Pauline. And
Thank you, Fran.
enjoy the rest of your Supply Side West. You've got a couple of hours left of the show, so make the most of it. I know it's a busy show. And safe travels home to everyone. Thank you so much.